Oral questions by members.
Leader of the Official Opposition.
Mr. Speaker, Diane Chandler was a 60-year-old mother, a Canucks fan, and someone who had spent years trying to find safety while living with addiction and mental health illness. In 2023, she moved into the Foxglove Supportive Housing Facility in Surrey, a site this Premier once celebrated as a model for complex care. But last April, she died of an overdose alone in her room, and it took 11 days before anybody noticed she was missing. Staff had mistakenly assigned another residence and falsely signed off on a wellness check that never happened. How did this government allow this to happen?
Minister of Housing.
Thank you so much, Honourable Speaker, and my heart goes out to this family. It's unacceptable for someone to pass away and the family not to be notified in that extended time frame. I appreciate that the people that work in supportive housing work in very complex environments, and it comes with great challenges. But it's vitally important that when this type of incident happens, that families are notified and BC Housing is notified. I appreciate the question from the member. I can share with the member that when this came forward, we issued a notice to the not-for-profit provider that they are now required to notify us within 24 hours if someone does pass away. I can share with the member that we also changed the RTV rules to allow supportive housing sites to do wellness checks. We issued guidelines to all of the not-for-profit providers that they're now required to do wellness checks every 48 hours and required every day to do a verbal assessment and a checklist to see who is coming in and who is coming out. All those changes were made in response to this specific issue and concerns that we heard from our not-for-profit providers last year, Honourable Speaker. Again, my heart goes out to this family. The goal of supportive housing is to support people with mental health and addictions, and we're going to continue to try to do our best in all of our communities to save lives, Honourable Speaker.
Member supplemental.
Mr. Speaker, once again, staff had mistaken another residence and falsely signed off on the wellness checks. But, Mr. Speaker, this story gets worse. Diane's children were devastated to learn the truth only after she was cremated. And as the minister has said, BC Housing never contacted the family and reached out to them, I should say. This was not just a tragic oversight, it was a complete failure of care, the failure of oversight, and a failure of basic human dignity. Mr. Speaker, although this is an issue, obviously, on the housing, this is a failure of our health system. The official opposition has been asking and calling out the Minister of Health on many, many issues. And I'm wondering today, Mr. Speaker, if the Minister of Health will stand up today, accept responsibility for this, and resign for the dismal state of healthcare in British Columbia.
Minister of Housing.
Thank you, Honourable Speaker. Again, I shared with the member our concern about what happened in this individual case. I've shared with the member the actions that we've taken place to ensure that all supportive housing sites have practices put in place that ensure that the residents are safe and taken care of. Honourable Speaker, I can share with the member that we've had debates in this building around having safe spaces in buildings where people can use and have healthcare professionals near them. I know it's been heated debates, but the reason why these spaces are created is so that people don't die alone, Honourable Speaker. And we know from the data that overwhelmingly people are dying alone. Even in this space, there was space dedicated to this, but because of stigma associated with drug use, this individual was alone. That, again, being said, we have seen some positive results of supportive housing in our communities, Honourable Speaker, but I know that is not something that's cold comfort for this particular family. Again, my heart goes out for them. I understand they're frustrated, and I would be as well if I lost a loved one in this situation. We have changed practices across the province, because of this incident. It all started last year, and we're going to continue to do what we can to support every single individual that finds themselves in either supportive housing or complex care.
Member for Skeena.
The story of Diane Chandler that the Leader of the Opposition just spoke about is not new to the opposition or this government. We've been bringing these issues to this chamber for weeks, and all we've heard are platitudes and excuses from the other side. I don't doubt their sincerity, but the fact is that they aren't getting the job done. So if the Health Minister and the Housing Minister are not willing to take responsibility for this failure, then I would ask, is the Parliamentary Secretary for Mental Health and Addictions willing to take responsibility for this problem?
Minister.
Thank you, Honourable Speaker. Again, I have laid out the immediate steps that were taken to address this situation to the member. The member and I canvassed this at great lengths in estimates as well. It's vitally important that we continue to have opportunities for people to get into housing, to get the supports they need. But we also have to work together to lower the stigma associated with using drugs, Honourable Speaker, because even in this situation where there was the space available for someone to use in a safe space with staff, it wasn't taken up. We have a lot of work to do, Honourable Speaker, but we are doing that. We're expanding opportunities in our communities for more people to come off. Surely the member would agree with me that if we want to save lives, the best way we can do that is to get people indoors, get them with supports that they desperately need in our communities. We're seeing results because we are seeing people having less interaction with the healthcare system, less interaction with the corrections and police system by having them in supportive housing. Again, it doesn't help this family. I appreciate that. I share in their sadness, but I can never imagine the pain that they feel. But that being said, we want to make sure we continue to expand this type of supports in all of our communities so we can help every single individual.
Member for Skeena supplemental.
This isn't an issue of stigma, this is an issue of incompetence. And the Minister is correct. We did canvass this in estimates already, and I can't help but notice that this specific facility, the Foxglove facility, wasn't mentioned, probably because this government knew about this and was trying to keep it quiet for over a year. It took 11 days to find this woman's body. 10 days later, another person overdosed there. Her daughter said that when she went to visit her there, she saw open signs of drug use everywhere. Mental health and addictions care is in chaos, and the blame rests at the feet of this Premier. The late Premier John Horgan did the right thing. He created a standalone Ministry of Mental Health and Addictions. He clearly saw the urgency in this crisis. This Premier axed this ministry and demoted its relevance to a parliamentary secretary who is utterly failing. Will the Premier swallow his pride and recreate a Ministry of Mental Health and Addictions and an actual mandate with measurable outcomes to finally solve the crisis that BC is facing?
Minister.
Thank you, Honourable Speaker. Every question that the member asked in estimates, I answered. And so to suggest that we were hiding something is utterly false. In this situation, I've laid out pretty clearly that the staff that were working there believed they saw the individual and put a check mark beside their name when in fact it was someone else. It was a mistake made by staff, unacceptable mistake in my opinion. That being said, we've taken considerable steps to address that. I laid those things out in detail. We heard from supportive housing providers that they weren't able to do wellness checks because they were limited by the rental tenancy branch. We changed that to allow them to do wellness checks when they felt it was appropriate, and also put in policies to be able to monitor who goes in and out of these facilities, not only for the safety of the people that work there, but for the safety of the residents that live there. I shared with the member that we issued a guidance to all supportive housing after the situation to say that they are required to do a wellness check on every individual every 48 hours and daily keep a log of who they see come in and who they go out, Honourable Speaker. I fully appreciate that this is not cold comfort for this family. I understand that. But what we're trying to do here is to ensure that we lower the stigma around mental health and addiction and create opportunities for people to get into safe housing and to get the supports they need. It's been successful for many, and I do acknowledge that for some it's just not enough, but we're continuing to do what we can to support everyone.
Leader of the third party.
Thank you, Honourable Speaker. As we've noted already, stigma around mental health support is a growing concern in our province. People experiencing mental health challenges are not receiving the support they need and are discouraged from seeking help out of fear of repercussion and judgment. There has been an undermining of trust in mental health support, which deters people from asking for the help they need. It's the role of our government to create conditions in society where people feel able and willing to seek help without fear of stigmatization and further barriers. My question is for the Minister of Health. What steps is the ministry taking to combat growing stigma to mental health support and increase public awareness of services so that those suffering don't feel helpless and alone?
Minister of Health.
Thank you so much, Honourable Speaker, and thank you to the member for the question, and again, raising the incredibly important topic of mental health and mental health supports during this week, Mental Health Week, May 5th to 11th. Mr. Speaker, this government remains committed to building out a continuum of care that fully integrates and acknowledges that mental health is part of everybody's health, physical, spiritual, cultural, mental. Mr. Speaker, that includes working in schools and working through public education campaigns to help reduce stigma. Increasing access for youth, Mr. Speaker, through programs like the Foundry and integrating child and youth care teams right into schools. Increasing access to counselors for just the average person living in British Columbia. Mr. Speaker, over the last year, over 29,000 people have accessed free or low-cost counseling, over half of them for the first time ever. It is so important that we have this conversation about ending the stigma around being your true self, about talking about the challenges that people face, about preventing small problems from snowballing into larger problems. Mr. Speaker, I am wholly dedicated to this work. I appreciate the member's question. Thank you.
Leader of the Third Party Supplemental.
Thank you, Mr. Speaker, and thanks to the Minister for that response. Addressing stigma is only useful if the continuum of care being provided is effective, evidence-based, and person-centered. Appreciate the mention of Youth and Foundry. As we know, implementing an early intervention system of care for those experiencing mental health challenges is a critical step that our healthcare system has historically neglected. Reactive spending on more policing and a reliance on crisis-level response has taken attention away from addressing the root causes of mental health challenges. Intervention should be in place at multiple levels of an individual's mental health journey before they reach crisis. For the Minister of Health, again, how is this government investing in preventative and proactive mental health care to provide British Columbians with the wraparound support they deserve?
Minister.
Thank you again, Honourable Speaker, and thank you to the member for the question. This year's budget includes $500 million of new funding to support mental health and substance use issues. Mr. Speaker, I've already spoken about some of the programs that this government has undertaken, and we're going to continue to do this. Mr. Speaker, we're going to continue to build out the continuum of care, to work with children and youth all the way through adulthood, doing everything that we can to normalize the conversations that we need to have, to support children and youth, to support adults, to help prevent small problems from becoming big problems, Mr. Speaker, because we see all too often, as we've canvassed in this House, these problems are serious and have absolutely devastating results for people and for their families. Mr. Speaker, this government remains committed to this work. We're going to continue to do that by integrating the Mental Health and Addictions Ministry back into health. We acknowledge that this is about holistic approaches to healthcare, Mr. Speaker, and we're going to continue to do that work.
Member for Abbotsford West.
Thank you, Mr. Speaker. Safety of seniors is a real concern. Seniors also deserve to walk safely down their own neighbourhood streets. However, under this government, all crimes reported to police against seniors, 2/3 were physical assaults. So, Mr. Speaker, why has this soft on crime premier left seniors to fend for themselves on the dangerous streets of British Columbia?
Minister of Public Safety and Solicitor General.
Thank you, Mr. Speaker. To the member opposite, it's important that we believe that all citizens in British Columbia should feel safe. As a matter of fact, the incidents of crimes against senior citizens are no greater than against other people. Our Repeat Violent Offender Program is a good example of an intervention program that we have to make a difference and to help people to break the cycle of offending. This crime that you talk about is largely perpetrated by people who are part of a system. And if we involve them, in this case, the Revoy hub, then we get to monitor them and we get to curb their behavior. That's a program that works, that's a program that speaks well of the system, and we will continue that program.
Member for Maple Ridge East.
Mr. Speaker, I have seen seniors being abused. I witnessed firsthand a man verbally abused his own mother, and according to the seniors advocate, reports of abuse and neglect of seniors rose 21% between 2019 and 2023. Can the minister provide updated figures today so we can understand the full scale and scope of senior abuse in BC?
Minister.
Thank you, Mr. Speaker. To the member opposite, again, I say that British Columbians deserve to feel safe all across the province. There is no greater an incidence of crimes against seniors than there is against any other group. We're strengthening policing in this province, also rebuilding the critical services that make people feel safe. The old government, the opposition leaders' old government, cut funding for programs like this for crime prevention and victim services. They ended the prolific offender management program that reduced offending by 40% overall. They cut $360 million from healthcare. Mental health and addiction services were lost or seriously reduced. What we have to do is deal with the problem, and we're doing it.
Member for Delta South.
Thank you, Mr. Speaker. Mr. Speaker, just yesterday, a 73-year-old constituent came into my Ladner office in tears. Her pension is $1,800 a month, her rent is $1,800 a month, and now she's broke and facing eviction in 9 days from now. Her belongings are about to be auctioned off because she can't afford the $1,200 storage bill, and the Ministry of Poverty Reduction denied her crisis help because she's not already a client. Is this what we've come to in British Columbia, Mr. Speaker? Seniors left homeless and humiliated.
Minister of Social Development.
Thank you, Mr. Speaker. That sounds like a very hard story, and I would appreciate working with the member so that we can find out what happened. And that we can get seniors the support that they need and deserve. Seniors' income support is delivered by the federal government once somebody turns 65, but that has not stopped our government from investing in seniors, expanding the SAFER grant to help them with rent, building affordable housing targeted especially at seniors. We've doubled the senior supplement that goes on top of federal income supports. And of course, building out more affordable long-term care and other supports. But I look forward to working with the member to navigate the system and get this individual the support that they need. Thank you.
Member for Langley Willowbrook.
Thank you, Mr. Speaker. Before the election, the Premier promised 4,000 new long-term care beds, yet months later, not a single shovel is in the ground. Meanwhile, seniors are stuck in 60-year-old buildings, hospitals are jammed, and this government quietly killed the Equip Care, a low-cost program that actually helps seniors. No beds, no equipment, no urgency. If seniors' care is a real priority, why does this government keep treating it like an afterthought?
Minister of Health.
Thank you so much, Honourable Speaker. It is so important to make sure that seniors have all the care that they deserve. They have helped build this province, and it's incumbent on all of us to do everything that we can to support people in this stage of their life. Mr. Speaker, that's why we are taking action across government, across many ministries to support seniors, and that includes adding more than 5,400 new and replacement beds at 33 different long-term care facilities. Mr. Speaker, it includes hiring more home care workers and expanding programs that help seniors stay in their own homes, because we know that when a senior is able to stay at home, they can live a healthier life at home, surrounded by their family and in the contact with their community, getting the supports that they need. Mr. Speaker, we've piloted a long-term care at home program for seniors, Mr. Speaker, a program that is having real results. We are not going to back down from the support that we know seniors deserve. We're going to keep doing this work.
Member for Richmond Bridgeport.
This government fast-track, low barrier, unsupervised supportive housing in Richmond without consulting the community. Meanwhile, Richmond's elders are stuck on wait lists for years without affordable, safe option. Why does the Minister of Emergency Management and Climate Readiness allow vulnerable seniors in Richmond always to come second under this NDP government?
Minister of Housing.
Thank you, Honourable Speaker. You've heard clearly from this side of the House that we realize the importance of supporting seniors. The member talks about fast-tracking projects in her community, supportive housing projects. Surely the member knows that the fastest demographic of people who find themselves homeless are seniors. The contradiction of all the questions talking about how do we support seniors, and the member stands up criticizing the program that we're putting out to support the seniors that live in that community, Honourable Speaker. Shameful. Absolutely shameful, Honourable Speaker. The member will also know. If the Leader of the Opposition has additional questions, I'm happy to answer them, Honourable Speaker. But
Minister, continue.
The member's asking about housing for seniors and supporting seniors. Surely the member knows that the largest investment in affordable housing for seniors in her community has come under our government, Honourable Speaker. We've invested in more affordable housing for seniors in Richmond that they've seen in the previous 30 years, Honourable Speaker. 30 years. And I appreciate the member is sensitive because she was the minister in the BC Liberal government and didn't take action to support those seniors with affordable housing in our own community. Honourable Speaker, we believe that supporting seniors during challenging times is vitally important.
Minister.
It's not about the press releases. It's about seeing the units opening up and seeing people moving in and realizing how big of an impact that makes in their lives, Honourable Speaker. We're going to continue to do that work across every single community in British Columbia.
Member for Salmon Arms, Shuswap.
Thank you, Mr. Speaker. I hope those announcements actually turn into completed projects. In Salmon Arm and across the Shuswap, seniors are facing an impossible choice: staying in aging homes they can no longer manage, or leave the region entirely because there are no affordable assisted living spaces available. Mr. Speaker, what is this government going to do to ensure seniors in Salmon Arm can access safe, affordable housing with appropriate levels of care before it's too late?
Minister of Housing.
Thank you, Honourable Speaker. Again, we value the importance of supporting seniors. The member opened his question saying that he hoped to see some of those units open. Perhaps I can share with the member Birch Place, 340 3rd Street in his community, 35 units open. Perhaps he can go and visit them. Honourable Speaker. Another 32 homes have opened up in his community, Large Place, Honourable Speaker. There's another 64 affordable rentals that are Andover Terrace, 2110 Lakeshore Road, Honourable Speaker. And there's a project right now under construction with Habitat for Humanity, Honourable Speaker. The member, I can assure the member that he's not seen this type of investment in his community before. If he believes there's more, I welcome that. I welcome him to raise that, Honourable Speaker. We believe in supporting seniors. We believe in supporting people in our community. That's why we're making the largest investment in the history of our province, Honourable Speaker, in affordable housing, because for 2 decades, governments decided that it wasn't a priority.
Member for Prince George Valemount.
Thank you, Mr. Speaker. Affordable housing is not assisted living. Aspen Seniors Housing in Prince George should be providing low-income housing for those in need. However, the Northern Health CEO has confirmed that units have been available for more than 6 months. Why, during a housing crisis, when there is no availability of affordable senior housing and the UHNBC remains overcrowded, is this government letting these housing units sit empty?
Minister.
Thank you again, Honourable Speaker. I appreciate the members asking a question, and I think the member knows what the answer is going to be. Also, the largest investment in the history of Prince George has come under our government investing in affordable housing, Honourable Speaker. Honourable Speaker, Quebec Street House, 36 homes open. Honourable Speaker, on 1919 17th Avenue, 57 units of housing open. Honourable Speaker, 679 Dag Road, Honourable Speaker, housing for folks with special needs. Honourable Speaker, we have on 2541 Oak Street, Prince George, another 6 units that have opened. 1975 Bowser Avenue, Phase 1, Honourable Speaker, 50 units open. I've got pages I can read through, Honourable Speaker, but I know we're limited for time. I will continue to say, members, to the questions that are coming today, we value the importance that our seniors have contributed to our province. We believe that seniors who have worked their entire lives deserve to be supported when they need it most, Honourable Speaker. That's why we've expanded SAFER program, so that not only seniors can get more money, but more seniors can qualify. That's why we're investing historic amounts of dollars to get more units open, because we believe every senior deserves to be able to live in the community that they've grown up in.
Member for Kelowna Centre. Member for Kelowna Centre.
It's great that, thank you, Honourable Speaker, that's great that the largest investment in Prince George ever, but doesn't still explain why those units are empty. In Kelowna, a senior was fined $27,000 for trying to move into her own home after renting it out to long-term tenants during the pandemic. This happened while she was undergoing critical liver treatment, and she had to move in with her daughter in Alberta. She wasn't flipping her house. She wasn't speculating. She was trying to recover. Why has this Premier created a system so cold and bureaucratic that even the sick get punished?
Minister.
Thank you, Honourable Speaker. It's hard to answer the specific question. Remember, there wasn't enough detail provided. If there are details, the member knows that we are available to help address specific issues. So I'm not sure if I'm not sure what the question pertains to, but I would just also say to the member, in the line of housing and affordable housing, that her mayor is here today. And he may even be in the chamber. I want to thank him for the amazing work he and his councillors have been doing. But Kelowna also has seen the largest investment in affordable housing in the history of this province. And so again, the member has a question, which I just apologize. I don't fully understand the context, but if there's details, I'm happy to get back to the member.
Member for Surrey White Rock.
Thank you, Mr. Speaker. Earlier in question period, my colleague from Delta South raised a pretty sad and tragic story. And the response from the minister was, bring it to me, we'll work on it. It's been brought to that minister's office, and it's been sitting there, sitting in the minister's office. Time and time again, in this House, we bring questions here to question period, and what we hear is bring it forward and we'll work with you. We've done that. We're bringing these issues forward, and we're getting nothing. So either the ministers are unaware of it, or they're choosing not even to answer. In some cases, we've got the receipts. We've got the receipts. The Premier got up and said he is going to work with every MLA in this House. Every MLA. So what do we get? Every NDP MLA has a title over there and responsibility. There is more political staff in this building than there's ever been before. Some ministers have over 8. And the fact is they can't even reply to an MLA on casework. It is absolutely unacceptable. say it's
Question-
not true. My
question,
question
member.
is a direct one, and it's to the Premier. Or to anybody.
Member,
Who am I? I'm the
Mem-
guy that does his job. You must be the other guy.
members,
Give me a break. The fact of the matter is,
Member, let's
my
get the
question is to
question.
the Premier, and it's a direct one. Does he approve of the fact that MLAs and ministers are unaware of cases that are coming into this office, or is he aware of the fact that they are not even responding?
Minister of Housing.
Thank you, Honourable Speaker. And first off, members across this chamber know when they come to ministers with issues, we work with all members to try to solve the issues. And the members complaining about emails, the member surely knows that he was with the BC Liberal government. He was with the BC Liberal government when they didn't reply to
Members,
emails.
members,
Honourable
members,
Speaker. Oh,
members, shh, members, come to order. Mr. Wilson.
They didn't reply to emails. They triple deleted them. They triple deleted the emails. In fact, they had the member from Surrey Cloverdale can't control herself, Honourable Speaker, consistently heckling in this place.
Member for Surrey White Rock. Question has been asked. Let the minister conclude it. We are almost done.
Thank you, Honourable Speaker. Now, my friend from Delta South asked questions about senior supports, and the member knows we have 300 affordable housing units for seniors opening up. I know he knows because he was there with me when we put shovels in the ground, Honourable Speaker. Honourable Speaker, the member from Surrey Cloverdale can't seem to control her temper consistently in this House. I'm happy to answer the question when she can.
Member for Surrey Cloverdale.
I'm glad the children have left, Honourable Speaker, because that is a poor example of how to act in this place. For a hopeful future leader of the Conservative Party, surely that's not how you want to act in this place, Honourable Speaker. Honourable Speaker, we continue to make investments, Honourable Speaker, historic investments to support seniors. I appreciate the member's concern about his email. We'll make sure we try to respond to all of their emails in a timely manner.
Members. Bell ends question period.